Hello, students from North and South. I'm Mr. Quirk, the 7th grade counselor here at South. Today, we're going to continue our career panel session and are fortunate to have some wonderful representatives from the public safety and health fields. First, we have Ms. Sarah Murphy. She's the clinical manager for Hendricks Regional Health. And we have Captain Gary Green, a recently retired firefighter from the Evansville Fire Department. Welcome to both of you.
Thank you.
Let's start out by having you share a little bit about your jobs. Start with Sarah.
Like you said, I'm a registered nurse with Hendricks Regional Health, and I'm the clinical manager for their school nursing department. I manage school nurses and clinics in Avon, Plainfield, and South Putnam School Corporation.
Okay, I'm like I say, I'm recently retired 3 days ago after 35 and a half years on the fire department. I was a company officer on an engine company here in Evansville, and I tell you a little bit about my job. I'm going to take a couple more minutes than Sarah did. So just give you a brief overview of what we do. And tell you a couple of things that I feel are important for you to know about our job. Probably most importantly is realizing what's expected from you as a public servant. And I call myself a public servant because that's what we are as police and fire and EMS. If in a couple of words, what we do is everything. When somebody needs help and they don't know who to call, they call 911 and somebody's going to show up. And so we do a lot of different things. To do a firefighter's job, in my opinion, you have to have a big heart. You have to be compassionate, and you have to be a caring and selfless person. And you must be of the highest moral character. People trust us. They look up to us as somebody that is going to do the right thing every time. And that's very important for them to have that trust in us. You got to be physically fit. And you also have to be mentally tough because we deal with a lot of bad stuff. We deal with some good stuff, but mainly we deal with bad things. When you're having a bad day, we come and try to make it better. Just a quick overview of our day, a snapshot of our day. My shift would start at 7 o'clock in the morning. You typically arrive 15 to 30 minutes before your shift starts. You check all your gear and get it on the apparatus and check out the apparatus, get ready to go. Check all of our tools and equipment, make sure they're ready. Our driver does a very extensive truck check, and that happens every day. The guy who worked yesterday did the same truck check, but if the truck doesn't start, we can't come and help you. If the pump doesn't work to flow the water, we can't put out your fire. So those things get checked every day. As a company officer, then I would conduct my roll call, make sure the truck and my crew are ready for our shift. And then you'll receive any instructions from your district chief for the day, any kind of training or public service or physical activities, etc. And then we normally eat breakfast because we're here 24 hours at a time. So when I come in at 7 in the morning, I don't get to go home until tomorrow at 7. So it's kind of like a home away from home. So we have breakfast, we'll work out, we do some daily training, we have lunch, take a nap. And that sounds crazy, but I explain to people this way, it's important because very likely we're going to get up at 3 or 4 o'clock in the morning to go help somebody. And we may get up several times during the night. And if I didn't take a nap that day, then I'm going to be pretty tired. So it's not unusual. Not everybody takes naps. And I didn't take a nap every day, but it's not unusual for firemen to take a nap. And that's not a bad thing. We'll have supper, we'll clean the station, have a shower, and then we sit down and rest in relaxation time. And we go to bed. And at 7 o'clock the next morning, we get up and go home. But during the course of that day, the tones could go off at any second, and we're going to be expected to spring into action. And when the tones go off, doesn't matter what you're doing, you're expected to be on the truck in a minute or so, ready to go. So that's kind of just an overview of what our day looks like typically. And we may make some days we might not make a run, and other days we might make 15 runs in a day.
Sounds like you have a busy job there for sure. Sarah, do you want to share a little bit about your duties and your day-to-day activities at your job?
Yes. My first responsibility each day is to make sure that all of our school clinics have a nurse to staff their clinics. And if not, I try to find someone to cover that. And if I can't find anyone, then I go and work in the school clinics myself. I make sure that all of the clinics are staffed, that they have the supplies they need. I support the nurses with their troubleshooting, helping them handle situations with parents if they have new disease process they're dealing with the student, or new diagnosis that they need some education on. I help with that and how we can handle those in the schools. I provide opportunities for education for the nurses, and I manage like billing and time cards and all sorts of paper pushing with when you're in management. But I also still have the opportunity to work in school clinics and care for the students.
Very good. We appreciate you supporting our school nurses for sure. So talk, both of you, about your training, education that you had to get the profession you're in.
I actually started working. I've only worked in the medical field my entire life. When I was 16, I started working for a medical clinic doing medical records. So when I worked there in high school, and then when I went to college to be a nurse, I went to Middle Tennessee State University in Murfreesboro, Tennessee, and I got my associate's degree in nursing there. And when I started working, I worked on a pediatric floor. I did home health as quality assurance. And I went back to school to get my BSN to be in management in my hospital, and all RNs at Hendricks Regional. You're required to have your bachelor's degree upon hire, or you have a few years to get that once they hire you. So that's how I got to my role. I worked as a school nurse for 9 years before I started working as a school nurse manager.
So to become a firefighter, at least at Evansville Fire Department, and I think this is probably true on most departments across our country, a high school diploma or a GED is all that's required to be qualified to apply for our departments. When I came on in 1987, we had what they call the political system, and it was strictly who you knew. And that's how I got my job. Once you get the job, they have a fire academy that you attend, and they teach you the firefighting skills that you need to be able to go out and work in the stations. In 1989, they implemented a merit system testing process. So basically general aptitude test and general physical ability tests are administered fairly to everybody, and they rank you according to your scores. And then they start the hiring process, starting with the number one candidate, working down the list. And then once you get hired on, you go through an extensive 16-week fire academy. When you come out of that academy, you're a certified emergency medical technician, and you have been given the basic skills and knowledge to become a firefighter. And so to be a fireman, you don't have to have a special skill necessarily. We'll teach you what you need to know.
So what made both of you choose the profession that you're in? Sarah?
You're muted, Sarah. Oh, there you go.
I chose to be a nurse because I really like to help people. And to be a nurse, I think you have to have compassion and empathy, and just a desire to help people. And especially as a nurse, most of the time you're seeing patients who don't feel well, they're in crisis, or they're dealing with health issues, and to be able to support someone through that is very rewarding. One of the other reasons I have to say, is I always knew I wanted to be a mom, and I liked the fact that as a nurse, I would be able to work that schedule around also being with my family. So there's so many opportunities to work. You can work 12-hour shifts part-time. You can work Monday through Friday. You can just work weekends and just make that schedule work for a family.
I didn't have any desire to be a firefighter as a kid growing up. I really didn't. Never thought about it. All through school, my career path was going to be in the commercial printing business. I enjoyed doing it. That's what I took, the classes I took in school. And as I graduated high school, I looked around and thought, I need a job. And one of my neighbors worked for the city and told me how the process worked to get hired on with the city. And so I went down that path. Hindsight being 2020, it was the best choice I ever made. I had no idea how well being a firefighter would fit my life and my values in life. And it couldn't have worked out better. But yeah, as a kid, I wasn't the kid who dressed up like firemen and had all the fire truck toys. I had never really thought about it.
Just never know what path is gonna take you in life. So it's always rewarding when you find that passion and that career that makes you happy. How long have both of you been in your fields?
I've been a nurse for, I have to do the math, 32 years. I didn't work continuously through that because I did stay at home with my children for a while. But I've worked in pediatrics, home health, surgery. I worked for a surgeon, actually in Evansville at Wellborn Clinic and Wellborn Hospital. And then I've been a school nurse. I worked in Tippecanoe County for a couple of years. And then this is my 14th year in Avon schools.
I've been with the fire department. Well, I've been in my present occupation for 3 days. So, but I was with the Evansville department for 35 and a half years.
Awesome. That shows the dedication. Like I said, when you find something you like, obviously sticking with it and making it a lifelong career is very rewarding for sure. What parts of your job do you like or love? And what parts do you dislike? Gary?
So for me, probably the part I like most is fighting the fires. That is definitely the most fun part of it. Also helping people. And the part I dislike the most of it would be we deal with a lot of death. And that can be hard to deal with. And then just the downtime. Like I say, there are days where we may go a whole shift without making a run, or maybe we only make 1 or 2 runs, and you're confined to the fire station, and we're allowed to go like 300 yards away from the building. And so because you got to be able to get back to the truck quickly. So if you're not making runs and you're not busy, you got to find something to keep yourself occupied. And sometimes that can be very boring.
I think what I like most about my job is the interaction with the students. In the years that I've been a school nurse, I've had several parents tell me that their child chose to be a nurse because of the relationship that I had with them. And in schools, I think not just nurses, but all different school staff become sometimes the person that a student really connects with, that you can make a difference in their lives. I really like that. And I just like the interaction with different people there. I do something different every day. The thing I like the least, it's probably as my role as a manager to evaluate and sometimes have not pleasant conversations with some of our staff.
That makes sense. Sometimes those hard conversations.
We can't hear you, Paul. You're muted. I think you're muted.
Oh, sorry. Yep. I clicked the button and didn't unclick me. Sorry about that. One of the questions that our kids always ask is, and they always want to know is kind of what can I anticipate making money wise as, in a particular career field and stuff like that. So Sarah, can you give us an idea of kind of what range they're looking at?
Yes, the average for nursing is in the high 70s. Indiana is a little lower than average. A new nurse just right out of school probably would make around 50,000. I'm in the ballpark, I think. And then you can just go up from there if you or get more education, which there are opportunities to learn all the time in nursing because the medical field changes all the time. But the more education you get, the higher your pay can get. And then there's most organizations, there's lots of opportunity for growth. And as you move up in the organization, then the income will increase.
So I went with fire departments. Basically, there is a set pay scale. So I have what I think some pretty accurate information from 2022 pay scales. In Evansville, our probationary firefighters, which is your first year of employment, makes $56,833. At the end of your second year, you get a pay raise to $59,723. And then there are set pay raises throughout your career. They don't come quite that large of increments after that first year. In Indianapolis, their starting pay is $54,215, which is less than Evansville, but your second year firefighters make $63,715, which is more than Evansville. But with the fire departments, one of the things that people don't, a lot of times, especially younger people, don't value is our benefits, our health insurance coverage, and our pension. We actually have a true pension. We don't have a 401k, and those things are just invaluable. And so that offsets what might be a lower pay scale than some other careers might pay. But if you look at the benefits and the pension, then we're right in there with some of the better paying jobs as people view them.
Yeah, there's a lot of things that go into, the career and how much money you're making and stuff like that. Because like you mentioned, not all careers have a pension money you're
Right.
going to get after you retire. So you kind of have to look at that when you're looking at jobs, to see kind of what money am I going to get now, but am I going to get any money later down the road as well? And that's one of the things that's nice about being in education as well. So
a funny comment to that, I was playing golf with one of my friends who retired a couple of years ago, and he made a comment to me. He said, "Gary, they pay me," and he had a dollar figure. "They pay me X amount of dollars every day not to come to work anymore." And I thought, that's a unique way to look at it, but it's true. You work your whole life, and then you get rewarded even after you're done working. Your career still rewards you with pay for the rest of your life.
yeah, true. In regards to, obviously our students are middle school students. What should they know at this age in regards to getting prepared for a career in public safety or health?
I think that they don't have to know what they want to do for life at this point, because I think a lot of students this middle school age and high school age put a lot of pressure on themselves to have life figured out, what they want to do, and they may not. But if they are really interested in helping others, if they like science, I think that what subject that they like and what they're truly leaning towards as their passion that they find, could guide them on choosing their career. But I would say at this age, just really start figuring out what you like, what you're going to enjoy as a career, because if you have a career you don't enjoy, then it's not going to be pleasant to go to work every day.
True.
I completely agree with what you said. I mean, I've written a lot of notes out here. I would have thought you were reading my notes right there, because we're thinking the same thing. Yeah, you don't need to know right now. You don't need to decide right now. If a career in public service is for you, you've got time. And if you possess the qualities that we've talked about, that as we're describing our jobs, then maybe a career in public service is for you. But it's never too early to start preparing, and there are things you can do. Your education is very important. If you're looking to possibly, you think you might want to be in the fire service, there are volunteer fire departments that you can start at as young as 16 years old in the volunteer fire service, and that would give you a good insight to whether you think that's something you may want to do as a career. There, as you get older in school, in your school life, there are fire science degrees, but probably also what would be valuable for preparing yourself for firefighting career would be like general building construction knowledge, things of that nature, because a lot of what we deal with is structural integrity type of things. We're in a building that's on fire or natural disaster and a building has been compromised, it's good to have some general knowledge of those things. So, but it's never too early to start preparing. And I 100% agree. If you're not happy with what you're doing, it doesn't matter how much money you make. You need to find a career that you enjoy. Money's important, but it's not the most important thing.
Well, one of the things we're fortunate with here in Avon is that we have the opportunity for our students as a junior or senior in high school to go to Area 31 and start learning some skills in public safety and health fields and stuff like that. So definitely encourage students that are interested in those types of programs to look at that as a potential for them during their junior or senior year in high school. To participate in Area 31 and get some skills and see if that is exactly what they want to do in the future. So, so to wrap things up, share one tidbit of whatever that you think that our students should know about your field.
In nursing, there are so many different opportunities. So many different routes you can take as a nurse. You can decide if you want to work with children, if you want to work with babies, if you want to work in oncology to take care of cancer patients, if you want to work in cardiac care with patients who have heart issues. You can work in an office behind the scenes. There are so many different avenues you can take. And so many different fields that you have the opportunity to learn and work in.
Very good.
So in the fire service, I would say it's a very rewarding job. There's no better feeling than to know that you had a part in saving somebody's life, and that's a lot of what we do. Fighting fires is a very small part of what we do. We do a lot of medical response and a lot of other type of jobs also, but there's no better feeling than knowing that someone was dead and you helped bring them back to life. And I've experienced that multiple times in my career, and you can't explain that feeling. There's nothing like it in the world. But I would also say this to your students, like we said a minute ago, whatever career you decide to pick, make sure it's one you enjoy, but also work hard. Employers are looking for workers that are dedicated and hardworking and committed to what they're doing. And if you strive to be the best at what you choose to do, you can go as far as you want to, because employers they're hurting for good employees. And so just do the best you can. Strive to be the best at whatever you choose to do.
Great advice. Great advice for sure. Well, thank you both for joining us today. Great to hear about what you're doing. Obviously, Gary, congratulations on retirement.
Thank you.
And I look forward to enjoying that one day myself, as I'm sure Sarah is as well. But thank you again. Greatly appreciate you participating today.
Thank you.